Good afternoon, all the participants who have shown interest in joining the today's webinar. I, Akhilesh Jain, on behalf of Wockhardt Hospital India, welcome you all in today's interactive session. As most of you already know by now that Wockhardt Hospital, which is the largest multi-speciality tertiary care group of hospitals. So today we have Dr. Jimmy Mirani, who is a senior consultant medical oncology at Wockhardt Hospital, Mumbai, India. So I would request Dr. Jimmy Mirani, sir, to continue the session, sir.
Good afternoon. So I'm going to be talking, my name is Dr. Jimmy, and I'm going to be talking about what are the different stages of cancer and what are the treatments that we offer for them, basically. So to start the topic, basically, I would like to go ahead with something which is very, very basic. It's very important to understand what is cancer in the first place, right? So let's start with a small example before I get on with the talk. The small example is that imagine if you end up having a cut in your hand because of a knife, because of a minor injury. What is the first thing that happens? The first thing that happens is your hand bleeds. You apply some pressure to the wound, the bleeding will stop. The minute this activity happens, your body signals the cells inside to start the repair process. And what happens is thousands and thousands and thousands of cells are made till the time the affected part is healed. So what will happen in terms of a cut is after you stop bleeding, immediately your body will start producing more and more and more cells, followed by which the first layer of skin will be produced, after which the cells will keep multiplying to form the second layer of the skin, thereby the third layer, and finally it will seal the wound in the coming days. Eventually, based on the extent of the injury and based on the depth of the injury, it will be decided whether there will be a scar or no. Correct? This is the normal healing of the body. Now, let's stop, let's pause for a second and let's think for a second. What happens if the cells continue to produce? They do not stop the production of cells even after an injury is healed. What eventually it will form a tumor. This tumor is called cancer, and at the end of the day, what I would say scientifically, it's known as a carcinoma. Now, it's a very dreaded word, technically speaking, like ever since I was a child too, everybody used to come up to me and tell me that, somebody got cancer, something happened, and we all know that, it's a very, very, very dreaded word. There are certain predisposing factors to this cancer, which particularly cause this cancer, which is in today's fast-paced life, wherein everything is so rapid, we don't have time for ourselves. So definitely number one is the sedentary lifestyle. Office jobs, nobody likes to work out, nobody has enough time to go out to do something, do some sort of physical activity rather. Secondly is smoking. Thirdly is alcohol. Fourthly, for women, is oral contraceptive pills. Fifth is the kind of food that we eat. Everything that's processed. Sixth is the red meat at the end of the day. Red meat, by the way, is considered to be one of the predisposing factors for cancer. Now, so also, and the main thing is the genetic makeup of a human being. Genetics play a very, very, very important part in getting a malignancy. All right. Now, the thing is that what happens? Why is cancer so dangerous? Why? It's just a small little tumor. What is it going to do to you? That's a simple question, right? This small little tumor consisting of the bad cells in your body may not directly kill a person, especially if it's in a place like a breast, or maybe if it's in a place like the abdomen, unless it's in the brain or unless it's compressing some major blood vessel, it will not kill a person. So how does a person die? Why are we so scared of this cancer? Apparently, what happens is one tiny cell out of the millions and millions and millions of cancer cells which have formed that tiny tumor, if they migrate to the bone, it will form a duplicate tumor there. if they go to the brain, it'll form a tertiary tumor there. If they go to the liver, it'll form another tumor there. Eventually, the patient will have such a heavy tumor burden that the patient will succumb to the injuries. This is the outlook of cancer. And I believe before I started my talk, this is something very, very important which every human being should know of what is happening. Cancer is not a disease. Cancer is not something like which has come through an infection, through any sort of sexual contact, through any other contact. It is mere genetics playing a pivotal part in the manufacturing of this disease. That's how I would put it. Now, starting my topic, which is how do we cure this? How do we treat this? There are technically, there are five modalities to deal with this dreaded C word. Number one, number one is surgery, of course. If an upfront surgery is available, that's the first thing you should do. Number two is chemotherapy. Number three is immunotherapy. Number four is targeted therapy. And number five is radiotherapy, finally. There are a lot of things which you must have heard, definitely, in your daily life. Like I hear a lot of things, when my family talks. My family, they are not doctors, so that's how I find out. They talk about naturopathy, they talk about homeopathy, they talk about proton therapy, they talk about something or the other, something new which is coming up every day, but none of the treatments are approved. Which we must keep that in mind because none of them have been approved by the American Association of Oncology, nor by the European Association. The only five things are chemotherapy, targeted therapy, immunotherapy, surgery, and radiotherapy. Now, coming to different stages of cancer. For example, if a patient shows up, I'm going to use something very common, which affects about, I would say, 10% of the women in the world, which is gynecological cancers and breast cancers. When we talk about a breast cancer, or when we talk about a CS cervix or something like that, how do we approach it? Number one, what we need to do is ascertain, once we have a biopsy which states that the patient has breast cancer, for example, how do we follow up? First thing what we do is to see how much has the cancer spread. The best way to do this is an investigation. It's like a simple CT scan, slightly upgraded. It's known as a PET CT scan. The scan will tell us exactly where all the cancer is present in the body. Now, once we know the stage, for example, if we know the patient is any of the three stages, stage 1, 2, and 3, all three stages, as we all know, are curable. That's why the tagline goes all over the world. Cancer is curable when detected early. So out of these three stages, the first stage, which comes up to us, is easy. Immediately just go up with a surgery. Post the surgery, whatever tumor you've taken out, send it for another investigation based on that report. I will whether the patient will require radiotherapy or chemotherapy or whatsoever. If it's stage 1 disease, the only thing like hormonal therapy, which is just mere tablets, are enough for the patient. Now, if it's stage 3, 2, or 3, wherein the disease burden is slightly more and we are afraid that the cancer might come back, we would want to give something which is known as NACT, which is neoadjuvant chemotherapy. Slightly technical, but I'll try to make it as easy as possible. Neoadjuvant chemotherapy are different chemotherapeutic drugs or agents which are technically given prior to surgery to the patient with the whole and sole intent of reducing the size of that tumor. Apart from that, what are the other things that we can do? Apart from that, the other things what we can do, once we have reduced the size of the tumor, we end up going for a surgery. Post the surgery, we give something known as adjuvant chemotherapy. All right. This adjuvant chemotherapy will prevent the tumor from coming back again. Basically, will prevent a recurrence of a tumor. That's about neoadjuvant and adjuvant chemotherapy. That's as simple as I could make it. Also, How does chemotherapy work? Is one of the most common questions which have been asked to me by my patients from all over the world, including India. Chemotherapy basically works by technically destroying all the cells. It's like a bomb. It's like dropping a bomb inside your body. The cancer cells will die. Along with it, the good cells will also die. That is why the patient has side effects. Now, coming to targeted therapy. Targeted therapy is a different sort of therapy which has relatively lesser side effects, not too many side effects, nothing much. So, targeted therapy basically is something wherein what happens is you just target the cancer cells, just the bad cells. So we give a lot of targeted therapy to our patients. Like there are wide array of drugs available now. There is cetuximab, there is panitumab, there is pertuzumab. All these are bevacizumab, all the mabs basically. These are all targeted therapies. There is something known which is the talk of the town these days. Everybody has been talking about it. The entire Google is going gaga about newer publications about this form of treatment, which is going to be the next line of treatment in the world in the next 10 years, which is known as immunotherapy. Immunotherapy is an excellent way to deal with a patient who has cancer. What it will do is the mechanism inside your body, which has gone wrong, which is constantly producing cells without stopping, it will reverse this mechanism back to normal. So the cancer cells won't grow. The remaining cancer cells will wither and die out, obviously, because each cell has a life. And eventually, the patient will be disease free or tumor free. That's what you would say. Coming to this, coming at the end of targeted therapy and coming to the end of immunotherapy and chemotherapy, what is next that's in line? So apparently, I still urge every single of my patients, and I still tell everybody that the minute you have some symptoms, the minute you start thinking something is going wrong inside your body, go to a specialist, get it checked. With the incidences of cancer on the rise throughout the world right now, if we detect it early, I can guarantee you in so many cancers like breast cancer, if detected in stage 1 or stage 2, the 10-year survival of a patient is close to 90-95%. Same thing goes in CA cervix, gynecological cancers. In a cancer, maybe in certain cases, even in cancer of the penis, in cancer of the skin, the survivability is pretty high if detected early. CA stomach, for that matter. There are different regimens which are available in today's time with minimalistic side effects. So many options for targeted immunotherapy therapeutic agents which we can give to the patients today, right? Wherein the patient may not only benefit from the treatment, the patient may not end up being cancer free, but the patient will also end up having very, 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 very few side effects at the end of the day, and definitely be cured at the end of the day. So what I urge everybody is at the end, what the health, our health is most important to all of us. And if anybody has any sort of doubts in your mind, it could be something as simple as loose motions, which are not being okay in the next 20 days, in the last 20 days, 25 days, maybe unprecedented weight loss. Maybe at the end of the day, if a patient is complaining of vomiting on and off, maybe, just once in 2-3 days, all these minimalistic symptoms, which we tend to overlook, if a patient is getting a lot of acidity every day, these symptoms should not be overlooked and you should see a specialist. Especially, and the detection of cancer is the most important, and detection of cancer early is the most important, rather, I would say. What I would personally expect from my patients, from everybody now, is not to be scared. There are so many patients today who are scared, who don't want, scared of chemotherapy, scared of so many things, right? At the end of the day, what I personally feel is rather than running away, it's always better to visit the specialist. And now with latest chemotherapeutic agents, the immunotherapies, targeted therapies, radiotherapies, hormonal therapies, all these therapies, There are newer drugs which have come, which can counteract, which can counter, rather, I would say, the side effects, the dreaded side effects. I personally feel that it's always better that we end up, going to the specialist and definitely diagnosing ourselves very, very as quickly as possible. Today's time, there are certain cancers which are definitely scary, like the cancer of the pancreas, cancer of the gallbladder, some sort of brain tumors, which still till date do not have a very good survival. But all other cancers, I would say about 70% of the cancers have a very, very good chance of survival for the patient. When it comes to lymphomas, when it comes, which is a type of blood cancer, when it comes to multiple myelomas, which is also a type of blood cancer, breast cancer, like I mentioned, cancer of the ovary, cancer of the cervix, stomach cancer, colon cancer, all these cancers have a very, very good survival chance for the patient if detected early. With this, I would like to go ahead with something which is like an interactive session rather than just me talking, which is, if you have any questions, I would want to answer those questions. So can we please go ahead if anybody has any questions about any sort of cancer at all?
Mine is just, I would like to find out why, because maybe it's just here, but many times patients are treated using chemotherapy and the radiotherapy, and
Correct.
not the other two which you've mentioned here. Why is that?
Yeah, so many a times what happens, like there are certain medications, right? There are certain medications wherein you do not need to use targeted therapy, or you don't need to use immunotherapy. Usually, if there is a patient who is straight up curative, but also nowadays, there are a lot of new things which have come up. Like I mentioned about targeted therapy in breast cancer, there was one point of time wherein we would just give chemo, followed by that, we would go ahead with, surgery, followed by that chemo again and radiation. But now there are so many studies happening which have proven that adding targeted therapies have yielded so much of a better response. 94% of the patients who have taken targeted therapy have not had a recurrence of the disease. That's what a recent study which proved last year in 2020, I believe. It was presented in Spain at the ESMO, which is the European Society of Medical Oncology. This was a study which was produced there. And yes, in India also, we have started using this trend. Following the West, we end up going with targeted therapy and immunotherapy straight up for patients in specific cancers, definitely that is. Any questions pertaining to any sort of cancer or anything, I would be more than happy taking the time out to actually just reach out to the people there and just give them whatever update they want.
What makes the cancer why does it come back in some cases?
You just need one microscopic cell to be left behind, one tiny microscopic cell. It will form a new tumor. It will, out of that, one more cell will go somewhere else. It will form another tumor. This in turn will cause a recurrence. Hence, the treatment of all the cancers usually compromises of chemotherapy or targeted or immuno or all three together, along with surgery, with or without radiation, to minimize the chances of basically. So that is the reason, like, many a times when a surgeon if it's a very bulky disease, and if the surgeon is confident, and if the surgeon decides no chemotherapy, I will just try and take out the entire tumor. And if he ends up leaving one little cell behind, that cell will cause a recurrence. Hence, we give chemotherapy, hence we give immunotherapy, hence we give targeted therapy to target those cells and get rid of them completely. Akhilesh, I'll be giving.
Yes, sir. So I think you can give a conclusive note so that we can end this session. Any takeaway message you wanted to inform to all the participants?
Takeaway message is just one thing, which is very, very simple. If anybody has any symptoms, please visit the specialist. Don't waste your time sitting at home. If you think that something is wrong with you in the last 10 days, 15, 20 days, however small it may be, end up going to the specialist, number one. Number two, don't be afraid if you are diagnosed with cancer also, because like I said, up to stage 3, most of the cancers can be cured now that we have so many treatment options. And last but not the least, don't be scared of the chemotherapy. Don't be scared of, probably at the end of the day of anything, it's just treatment. It's just going to get you better. So visit the specialist, eat the right things, take out 10 minutes from your daily life, go for a walk outside, eat healthy, and just stay fit. That's about it.
I've got one more question. Sorry.
No
You've
problem.
talked about eating well, eating well. What kind of diet do you give to a cancer patient?
I would first
Is
say
there a standard diet for cancer patients?
for cancer patient, the standard diet would be anything which is
Or
rich.
even after
Yes.
cancer treatment?
After cancer treatment,
Kind of diet, what kind of diet should the patients who have been treated with cancer be on?
Exactly. Number one, cut down on red meat, cut down on smoked food, which is barbecues, anything which is made in the Indian tandoor, anything which is smoked, like a smoked chicken, smoked fish. Number three, and most importantly, make one note of this thing, avoid eating processed food. 70
Okay.
to 60% of your diet is processed food. If you go to McDonald's, it's processed. If you buy a sausage and you stock it in the refrigerator or in the freezer, it's processed. You eat a jam, it's processed. Eat everything which is healthy, eat everything which is made fresh. I won't say beyond salads, but anything, any sort of food. Like you can buy something, a fresh cut chicken rather than buying a frozen chicken. In the morning for a breakfast, go for an omelette rather than going ahead with something which is a salami or sausages. Avoid red meat. Avoid red meat. I don't say that don't eat red meat. I personally love red meat, but I would say avoid it, limit it maybe to once in 15 days. That's what I would say. And for cancer patients who are on treatment, I would recommend that we should go ahead with something which is a high protein diet. But for cancer patients who are already treated, are fine, are living a normal life, they can just eat whatever they want. But with the same restrictions, no processed food, no red meat, the same thing. Any questions, please?
I just want to understand more on the targeted therapy. What is it in that therapy?
So targeted therapy at the end of the day is usually given with chemotherapy, along with chemotherapy. So the patient will receive chemo and the patient will receive targeted therapy as well. Now, this targeted therapy at the end of the day is given in an intravenous form, like how anybody receives an IV. That's how you give targeted therapy. It targets the cancer cells directly without targeting the good cells. It has minimalistic side effects. That's about targeted therapy, which I would tell you. Other than that, it depends upon what targeted therapy which we are talking about. Are we talking about trastuzumab, pertuzumab, pembrolizumab, nivolumab? What are we talking about?
Are they so expensive than the other chemotherapies that we know?
Yes, that's right. Chemotherapy is cheaper, targeted therapy is more expensive, and immunotherapy is the most expensive. But at the end of the day, in certain patients, targeted therapy is doing wonders. Like, for example, in colon cancer, we use something known as cetuximab or bevacizumab. It gives even in stage 4 cancers, it increases the lifespan by at least 1 to 2 years, despite the cost. Second thing is, if you look at targeted therapy in breast cancers, now there is a new treatment protocol wherein we use 2 targeted therapies and 1 chemotherapeutic agent. The 2 targeted therapies are trastuzumab, pertuzumab, and along with that, we give a chemotherapy of paclitaxel. Goes on for 1 year, even in stage 1, stage 2, stage 3 patients. And the patient has an excellent response. 94% of the patients do not have a recurrence.